So the video that I want to do today is about the diagnosis of Will's cleft during my pregnancy. So for us, it started much earlier than most people. Around 13 weeks I'd had a bleed that wasn't severe enough for the NHS to scan me, but as first time anxious parents to be, we decided to pay for a private scan. Luckily within 24 hours I was able to be sort of fitted in to be seen, and we actually, the clinic was in Mothercare, so we kind of decided that if everything was okay we would have a little celebratory look around and, you know, just get some ideas and just make a nice situation out of quite an anxious situation. So as we arrived, I explained what the situation was, and the sonographer, he was so nice, very kind of relaxed and kind of the same ages, so we just had a bit of a general chit chat about restaurants in the city, and as he was scanning we could see a heartbeat, and you know, straight away we were like, bonza, like we know that everything's okay and it's fine. And then he said to me, do you want me to see if the baby has a cleft lip? Pardon? So really in like a split second I was kind of thinking, why would that even be a possibility? Because every time I asked a health professional growing up, would I ever have a child with a cleft, they always said to me, it's not hereditary. So my takeaway from that was, no, there's no reason why you would have a baby with a cleft, don't worry about it. So of course we said, yeah, absolutely, have a little look, and within seconds he said, yeah, I think I can see a bilateral cleft lip. Okay, and I had so many thoughts sort of going through my head, because A, it wasn't something that I was prepared for, B, I couldn't really believe what he was saying, and straight away I was like, yeah, no worries, it's all good, not a problem, yeah, cool as a cucumber. And he said, okay, so just make sure you tell your midwife and they'll do referrals to the cleft team, blah, 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 blah. Jumped up off the couch, yep, see you later, mate, thank you very much. And I tell you now, I walked out that door and went straight to the car, so there was no niceties around it of shopping and looking at clothes. I went straight to the car, got in the seat, and I just lost it. I just could not believe what had been said. I was relieved that the baby was okay, and then I was so shocked that this diagnosis had been established, and that was probably my sort of emotion and feeling for about 4 days. I don't think I got out of bed for 2 of those days, and I just sobbed, and I don't think I'd cried like that since I was a hormonal teenager crying about whatever. Yeah, I was overwhelmed, shall we say, and I say that in a very light-hearted manner, but actually it's something that I will never ever forget. Now, I'll be totally honest in when I say I was probably quite selfish in the very immediate of, you know, what are people going to think of me? What are people going to say about me? Are people going to think that I'm stupid because I hadn't considered it? And all of this is like going through my mind whilst I'm not even telling anybody or talking to anybody. And then obviously my feelings sort of switch to, I've given this baby this thing, this condition. And obviously I can only relate that as me being the person that's directly given a baby a cleft, as opposed to a mum that this condition has just popped up out of nowhere. I had to consider, you know, were people going to be horrible to the baby? What were they going to say about it? How was the baby going to be? Is the baby going to have any other conditions? Is the baby going to be able to live a normal life? Is the baby going to be able to, like, literally anything and everything you could think of, that from like where this idea of like your normal baby is, like, it just changes in a split second. And running alongside that diagnosis is, you know, you're kind of warned that it might be an isolated condition, so it might just be the cleft. Obviously there could be a cleft palate, but it might just be under the sort of cleft umbrella, shall we say, or it might be symptomatic of another syndrome. So there's lots of other conditions and health implications that a cleft can just be like a symbol of. Hopefully that makes sense. Like, it might be something here, and a cleft might just be one of the things that happens to occur as part of that syndrome. Now, during the consultation, the sonographer did say to me, I need to make you aware that termination is a possible route that you can go down because of this diagnosis. Now, I could almost feel like the embarrassment oozing out of his pores, because, you know, he's having to sort of say to me about termination when it's actually a condition that I was personally born with. But whenever I talk about this subject, I get a lot of contact from people saying, you know, how can people terminate just over a cleft? And people don't understand it or don't agree with it. And as a bit of background to me and how I dealt with it, with that sort of scenario, I worked in sexual health for 10 years, and termination was a common discussion that was had. So for me, I definitely detached any sort of emotion from him actually discussing that with me, because I know that it's just something as part of his job role that he has to discuss, as opposed to him saying like, oh, you know, maybe you should consider this. Obviously helped in that situation because I could understand the medical standpoint as opposed to how I personally felt about that question. But I do empathise with both sides of the coin. I understand that people may need to consider termination as a route, and I understand why people are sometimes quite offended that people would even consider that as an option for a baby that has a cleft. So what I did recently was a poll to see who was not offered a termination, but who had termination discussed in a diagnosis consultation and who didn't, because I'm intrigued as to why some people are and some people aren't. 58% of people that replied, so that was 38 people that responded to the poll, actually said that they weren't offered a termination, and 42% of people were. So that was 28 people that were advised, you know, about a termination. Like I say, I don't know why some people have that conversation, why some people don't. But here in the UK, it is a statistic as to why people can terminate. So people have to make informed decisions. But I say that in a sense that people need to know their options. But with a cleft, as I have often mentioned, you don't know the severity, and you don't know. Cleft is almost like a very grey area as far as I'm concerned. It's not black and white, it's very much like a light grey here, a dark grey over here. Like, you don't, like, not one person's situation is the same. So I think people have to kind of absorb as much information as they can, but it's really hard. And as I said at the start of this video, we found out really early, which was almost like a double-edged sword about the diagnosis, because we had so much more time to absorb what was going on and understand it and meet people and talk about it and do research, whereas most people only find out at their 20-week anomaly scan. So they only have a few weeks to make certain decisions, and that's a lot of information to go through in a very short space of time. And another question I actually asked on the poll type of thing was, were you made to feel that during the diagnosis that everything was going to be okay, or should you be worried? Now, 67% of people were told that everything was all good, it was a really common thing to happen, try not to worry, and 33% of people were made to really worry. I think a lot of that comes down to trying to give as much information as possible during that one consultation, so people kind of get a very general oversight of what the possibilities are. But I really think it's very dependent on that health professional. It's kind of what I've taken away from everything that has been sort of sent and sort of messaged to me. I'm just going to read you some of the messages that people sent me in regards to whether they're made to feel that everything was all good or whether it was something to worry about. And people said things like, the scan at the hospital immediately mentioned very serious genetic conditions, reassured about the cleft, but when I was aware that there were other issues, I felt really lost. Consultant very focused on how challenging it would be. Significant diagnosis but not uncommon, and care plan for every step. Sonographer wasn't sympathetic. She said she was just doing her job. Nurses made me feel like I should be more concerned. Felt the doctor was very blasé. Felt like I should feel like it was just a common cold and shouldn't be sad or scared. Advised to have amnio done, but unlikely to find anything else. So a really mixed bag of how people felt during that consultation. As a personal standpoint from all of that information, it's kind of, what I take away is that it's down to that individual healthcare professional as to how they deal with that situation. If they see it all the time, they might be more sort of blasé, and you know, they might be telling you all the serious things that could be an issue on the basis that hopefully it's not. But I think it's, I mean, literally as soon as you are told about that diagnosis, your cleft journey starts, and that individual that's giving you that life-changing diagnosis will massively impact on how you initially deal with that situation, and possibly how you then view the whole journey to come. You know, if someone goes, don't worry about it, like, you know, it happens all the time, 1 in 700, we've got, you know, centres of excellence, it's all good, not a problem. You're going to come out feeling probably a bit more confident than if someone said, you know, there are very serious conditions that are related to this. So yeah, like I say, my biggest takeaway is possibly that the healthcare professional that you are first introduced to for the diagnosis plays a massive part. So as a very quick summary, the cleft diagnosis is usually found at the 20-week anomaly scan, and it's actually something that they look for during that scan. Within a split second, your world changes. During consultations, people will be made aware that it may be an isolated incident or it may be symptomatic of a syndrome. Be discussed. Like I say, I don't know why some people have that conversation and why some people don't, so if you are a sonographer, please do get in contact with me. Ultimately, I think the healthcare professional that you see who establishes that diagnosis plays a massive and significant part of your cleft journey.